Turning now to health news, and Daat, the Health Information Service, a joint venture of Hadassah and Yad Sarah, is trying to improve the lives of Israelis by helping them to become better informed medical consumers. IBA's Sheila Zucker spoke to Daat founder Nava Dolev about how this unique organization works.
We ask patients to call. Patients is us. To call from everywhere, anywhere in the country, anywhere that they stay in. They can give us a call. They would tell us about their diagnosis.
In English?
In English. Usually they say to us that they got a certain indication that they have a so-and-so disease. They got the diagnosis. They got from a doctor. They got it from the caregiver. It might be sometimes that they get some lab results that they do not understand, some kind of reading of MRI or CTs that they do not understand, and they tell us what it is, and they ask to understand more about it. And basically we are all 60 volunteers and professionals that are working in the entity, and we do try to make the information that it will be understood by the lay public.
Wait, before we get to the information, who are the people answering the phone? What kind of a background do they have to be able to answer the questions?
Right. They are all from the medical field, starting from physician, nurses, lab people, and all kind of life sciences people. And to aid us with all the organization, we have librarians and information analysts that work with us to organize all the information.
Now, if they call up about a specific disease, how do you help them? They can go to the computer themselves. They can get 500,000, 6 zillion different articles about diabetes.
About anything.
How do you help them?
So the main difference between us to the lay public, that first of all, we do have a gigantic collection of books and journals from the entire world that really provides very accurate information right to the point. And secondly, we do have all kind of programs that we purchase for a lot of money that are geared and built to the patient themselves, other than the Google type of investigation, which basically everyone can do it, but not everyone can understand it.
But this is not a second opinion from a doctor.
It's not a second opinion from a doctor. Second opinion has to be written by a doctor, and we are not using a written information that we are writing alone. We are using all the information from the entire world. We collect the information.
In other words, that you gathered.
We gather all the information and we tailor it to the specific question that the patient has.
How does it get to the patient? How does it get to the person calling you?
We gather the information. The information is gathered by the volunteer that sits there and for several good hours and do a research, a very thorough research on the subject, gather all the articles and all the information that was written anywhere in the world, collect all the information, print it, and send it free of charge to the patient's home.